Next, we would like to invite Dr. Pratheeba Devi Nivean, and she will be speaking on tier biomarkers to predict activity, South Indian Thyroid Eye Disease Study. Dr. Pratheeba, please.
Respected teachers, judges, and colleagues, I am Dr. Pratheeba Devi Nivean, and I'm here to talk about tier biomarkers to predict activity, a South Indian Thyroid Eye Disease Study. Thyroid eye disease, as we all know, is an autoimmune disorder. The pathogenesis and understanding of the pathogenesis is evolving. There are a lot of newer targeted treatments which have come and have been successfully proven to be treating the activity of thyroid eye disease. We know thyroid eye disease has varied stages from simple mild lid retraction to a very dreadful, visually debilitating disease with dysthyroid optic neuropathy. What do we do? Current scenario, we treat the patient based on the clinical activity scoring or the VISA scoring and treat them with high steroids or immunosuppressants after the disease has become very active. What is lacking is we treat after the disease has established very well when we have lot of targeted therapies already existing in the market. So I did some literature search. I found that there were a lot of researchers in this aspect which was done to find biomarkers causing activity and severity in patients with thyroid eye disease. This particular article was very interesting in Biomolecule Journal, where they have done a meta-analysis and they have compiled the work done in tier biomarkers on thyroid eye disease, and they have come up with certain inflammatory cytokines which have been elevated in thyroid eye disease. And on the other hand, I did find that there were a lot of targeted therapies which have been already currently being used after randomized controlled trials, proven to be very effective in active eye disease. So what could have been ideal is to identify the patients who will probably develop a disease based on molecular analysis and treat them before they develop the disease. So where do we look for biomarkers? We can get it from any human tissue, but tears is very easily accessible and it is non-invasive. And so why here and think under the apple tree this topic is just tweaking the thought process in management from the existing guidelines, probably to look for biomarkers causing activity in thyroid patients and treat them early before the active disease could reduce the morbidity in such patients. But as of now, in India, we do not have any background data about the thyroid tier markers. So we aim to find significant markers that cause severity and activity in thyroid eye disease patients. It was a pilot study done prospectively after ethics clearance. We did take the tear samples from 2 tertiary care centers. Schirmer strips were used. We included patients with eye disease, without eye disease, and healthy controls. We performed multiplex ELISA, and we looked in for the inflammatory markers, the cytokines, which were already been proven in literature to be elevated in thyroid eye disease. And this was the result. We found that most of the inflammatory markers were elevated in patients with thyroid eye disease compared to patients without thyroid eye disease in spite of having systemic thyroid dysfunction. However, we found a statistically significant increase in the values of interleukin 6 and interleukin 10, which made us think that probably interleukin 6 and interleukin 10 could be a potential cause for a disease development in thyroid patients. So just by tweaking the therapeutic approach, like looking for markers in patients with thyroid disorder and treat them with specific antagonist early in the earlier days, could probably prevent them from developing a bigger proptosis or a visually debilitating condition. So to conclude, finding the most vulnerable candidates who succumb to the disease would reduce the morbidity, and this works as a prevention and could avoid high-dose steroid treatment. I would like to acknowledge the people who helped me during this journey. Thank you.
Thank you, Dr. Pratheeba. Judges, please.
Interleukin 6 and interleukin 10, the ratio is increased in the particular interleukins 10 and 6 in various cancerous diseases like primary intraocular lymphoma, where you get IL-10 high and IL-6 low. Your finding, I don't know that whether this is an inflammatory marker or a kind of a biochemical marker of these presentations. So thyroid is an autoinflammatory disease.
Yes, sir.
Okay. So what is exactly the role of
So sir, my thought process was, in thyroid patients, if the tears shows a higher levels of interleukins, probably those are the patients who would probably develop thyroid eye disease, so those patients would need a closer follow-up. And if the value is more high, probably they should be started on specific antagonist with like interleukin 6 antagonist, rather than giving steroids after they develop an active disease. That was my thought process, sir.
What was the cutoff level of interleukin 6? Like, what was the value which will say that this will be going for the thyroid eye disease?
Ma'am, there is no specific guidelines available as of now, ma'am. We have to go a long way to find out.
Did you do the analysis and did you find out anything in that? Only you are showing that it is increasing, but there are other things which is going on also. So have you seen that, or have you seen in the serum if anything is coming? Because these patients are also in the endocrine, if you work with them together, you can get something. So that is what I am just
Okay, ma'am.
suggesting.
This is just a small pilot study. There's a small start.
And how did you take the tears from them?
Schirmer strip, ma'am.
Okay, so
We took Schirmer
basically it is
strip.
a biochemical test you have done.
Yeah,
That is what we are talking
multiplex
about.
ELISA was done.
Yeah.
It was stored in -90-degree
Yeah.
refrigerator.
Yeah.
It was
Okay.
transported to a lab where they do this paneling
Yeah.
testing.
Thank you, Dr. Pratheeba. I'd like to request Professor Jeevan T. Alsat to please give a certificate of appreciation to Dr. Pratheeba.